Hi, I'm Austine Oywer. I'm a medical officer and an ENT resident, and I'm partnering with Ponea Health. Today, we'll be discussing about epistaxis. So, epistaxis is when you have bleeding from your nose, either from the anterior aspect or the posterior aspect. From the anterior aspect, the nose will fall anteriorly. From the posterior aspect, it will go back into your mouth. The causes of epistaxis vary, and they can be divided into two major groups. They can either be local causes or external causes. Local causes include things like infections, where you have an infection in your nose and it ends up causing epistaxis. You might have also trauma to the nose, usually from a blow to the nose or a fall. Sometimes you might have foreign bodies in your nose that will cause injury to the mucosa of the nose and cause nose bleeding. The other cause could also be if you take too much alcohol and you develop vitamin C deficiency, that would also cause you to have epistaxis. The other causes of epistaxis can also be tumors, where there's a growth in your nose that's constantly expanding and it exposes the various blood vessels in the nose and causes the epistaxis. The commonest cause, usually in children, would usually be from nose picking, which is very common. So you find the children will be picking their noses and they will report that they usually develop epistaxis shortly after picking their nose. Some of the risk factors associated with epistaxis are patients who have hypertension. Hypertension has been shown to cause atherosclerosis, which affects your blood vessels and may lead to epistaxis. The other risk factor could also be children, usually from the nose picking. The severity of the nosebleed can be determined by factors such as elderly patients. These patients usually decompensate very quickly from blood loss of even small amounts. The other factor that determines the severity is the amount of blood loss the patient has been experiencing, and they may end up having low blood pressures or a very rapid heart rate. So when a patient presents to our hospital and they've been having epistaxis, our first order of business would be to evaluate the patient. We want to find out, is the patient clinically stable? We'll look at the blood pressure, we'll look at the pulse rate, and we'll be able to determine if the patient is stable. From there, we'll resuscitate the patient appropriately and then move on to specific management. The first order of business is to try and do first aid, where we'll ask the patient to pinch the nose for about 3 to 5 minutes and see if the epistaxis resolves on its own. If that doesn't work, we might proceed to other measures that include anterior nasal packing, where we'll use either nasal tampons or we'll use gauze strips that are packed with adrenaline or paraffin that will help in stopping the nose bleeding. If anterior packing does not work, we might proceed to do posterior packing. If this does not work, we might actually have to take the patient to theater, where we'll have to do something called cauterization. So cauterization, we might be able to do it just by applying silver nitrate sticks to where the bleeding is occurring, or we might need to use other methods. The final and optimum method would usually be either embolization or ligation of the blood vessels still in theater. So let's say epistaxis occurs at home. The first method you should try is usually pinching your nose. That's basic first aid. Pinch your nose and hold for 3 to 5 minutes as you breathe with your mouth. If this doesn't stop, then you might need to come to hospital. Prevention of nose bleeding would include 1, stop nose picking, 2, patients who have hypertension, make sure that your hypertension is well managed, 3, of course, avoid any trauma to the nose, and 4, if it occurs, make sure you try your first aid measures immediately. Thank you for joining us in this discussion. You may book our services through ponea.com. See you on the next episode.